the revolutionary APP developed in Australia that provides consumers with easy-to-understand information about packing food nutrition, telling them the salt, fat and sugar content of a product by scanning the barcode and suggesting healthier alternatives, has been launched in India. The FoodSwitch app, developed by the Sydney-based George Institute for Global Health, provides consumers with the knowledge and support needed for better eating habits across India and is aimed at reducing the burden of diet-related diseases and promoting a healthier population, its developers say. The application, which was funded in part through an Australia-India Council grant, uses the established traffic light labelling system, red high, amber OK and green good, for evaluating products. Bruce Neal, Senior Director at the George Institute for Global Health, said at the launch of the APP that the Australian High Commissioner's residence here on Wednesday evening that FoodSwitch makes the sometimes complicated information on nutrition panels immediately understandable. FoodSwitch helps consumers evaluate the nutritional content of packaged foods and, when they can be found, suggests better options, he said. Neal, who led the team developing the application, said diets high in salt, sugar and fat were now causing major health problems in India. This app will be a great help to those trying to stay healthy. We know that it is really hard for people to grasp the meaning of the nutrition panels on foods, he said. Australian High Commissioner Patrick Suckling welcomed the practical engagement between the Australian and Indian health sectors. Australia has been engaging with India's health sector for decades across a wide range of activities in R&D, skills training, commercial engagement and on a government-to-government level. This FoodSwitch application highlights the importance of proactive and creative approaches to preventative health measures and demonstrates Australian innovation and commitment to health outcomes, he said. Available for iOS and Android consumers free of cost, FoodSwitch is backed by a database of about 10,000 packaged foods compiled in collaboration with the Centre for Chronic Disease Control in India. If a scanned product is not in the database, consumers can use the phone camera to send in photos so that it can be added. In Australia we receive about 150,000 photos each year, which allows us to keep the database completely up to date, Neal said. This element of consumer participation has been really exciting for us. This will be the largest country that we have launched in, and there are unique challenges with the size and scale of the country, as well as the number of foods and grocery stores. Consumer participation will be important so that more people can benefit and improve their health. The data behind the FoodSwitch app also supports programs by the food industry and government designed to improve the healthiness of packaged food. Vivek Nagjog, Executive Director of the George Institute for Global Health in India, said he hoped Indian consumers would use FoodSwitch when they did their shopping. But we also want to work with the Indian food industry and government to improve the quality of the food supply. If we can make even small changes to the average levels of salt, sugar and harmful fat in the food supply, this could go a long way in combating India's epidemic of non-communicable diseases, he said. Already launched in Australia, Britain, New Zealand and South Africa, the app has had more than 600,000 downloads worldwide. The George Institute is a not-for-profit organization conducting scientific research in public health and medical sciences. Affiliated with the University of Sydney, the institute today also has offices in India, Britain and China, and is also affiliated with the University of Hyderabad, the Peking University Health Science Centre and the University of Oxford.